Hello and welcome. Today we are going to talk about something really important called dialysis. Think of your kidneys as your body's amazing cleaning crew. They work day and night to filter out waste and extra water from your blood, keeping you healthy and balanced. Sometimes, though, kidneys need a bit of help. That's where dialysis comes in. It's a special treatment that steps in to do the cleaning job. It might sound a bit complicated, but it's a life-saving process that helps many people feel much better. Before we even think about starting the dialysis machine, there is one step more important than anything else: checking in with you, the patient. This is called a patient assessment, our essential first step every single time. This assessment is not just a quick hello. It is a careful, thoughtful check to make sure everything is right for your treatment. We want to be sure you are feeling well, that your body is ready, and that we have everything set up to keep you safe and comfortable. This special 10-minute check-in is our promise that we put your safety and well-being first. It's like a pilot doing a final check of the plane before takeoff. They look at every dial, every switch, and every part to ensure a smooth, safe journey. In the same way, your dialysis care team looks at every detail of your health before we begin. This special 10-minute check-in is our promise. And it sets the stage for a successful, gentle treatment. So, what are we really looking for during this important time? We are checking your vital signs, blood pressure, temperature, to see how your body is doing today. We are also looking at your dialysis access, your special connection to the machine, to make sure it is healthy and ready to use. This isn't just about numbers and medical checks, it's also about connecting with you. Sharing how you feel helps us give you the best care possible and makes you an active partner in your health journey. This focus on you from the very beginning is the heart of great dialysis care. It ensures every dialysis session starts on the right foot, with you at the center of it all. Disclaimer: this video is intended for educational purposes only and must never be used as medical advice. Please consult your doctor for any personal health concerns. Now let's look at the big picture and understand why this pre-dialysis assessment is so vital. The main goal, above all else, is to keep you safe. Your body can change from day to day, and these changes can affect how you respond to treatment. For example, your blood pressure might be a little lower than usual. Or you might have gained a bit more fluid since your last session. By checking these things at the start, we can adjust the treatment plan just for you, for that specific day. This prevents problems like feeling dizzy or unwell during dialysis or after dialysis. It helps avoid complications caused by removing too much or too little fluid. It's all about tailoring the care to your current needs. The goal of dialysis is to remove the right amount of waste and extra fluid from your body. Not too much, not too little. If we guess, we might remove too much or not enough, both of which can cause problems. This careful measurement is a cornerstone of effective dialysis. One of the biggest risks in dialysis is infection, especially around your vascular access point. A small unnoticed sign of redness, swelling, or drainage could be an early warning. By catching signs early, we can take action right away. This simple, quick check can prevent a serious problem that might otherwise lead to hospitalization. Finally, a consistent and thorough assessment process builds trust and confidence. When you know what to expect at the start of every session, it creates routine and predictability. You see your care team following the same important steps each time, showing their dedication. It helps you feel secure, knowing that you are in good hands. In training, we practice until it becomes automatic. This consistency shows we have a strong system in place to protect you. It helps you feel secure and supported. Knowing that your team follows these steps makes the dialysis clinic one of the safest places you can be. Quick break. If you enjoy this video, please take a second to like and subscribe. Also, check the description below for links to additional useful resources. Dialysis care is not a one-person show. It's a brilliant team effort. You are the most important member of that team. Think of it like a well-rehearsed orchestra where everyone has a special part. The doctor, or nephrologist, creates your overall treatment plan. Skilled nurses bring the plan to life and care for you directly. Dialysis technicians are often the machine experts. They set it up and make sure it runs perfectly. Learners in simulation step into the nurse's shoes to master hands-on skills and communication. Hands-on practice is essential. We practice communication as much as we practice technical skills. Nurses become the eyes and ears of the team, noticing small changes. They listen to the patient and the machine, and make sure every step of safety protocol is followed. They are with you through the entire process, from the first hello to the final goodbye. Nurses and technicians work hand in hand to make treatment happen. Technicians calibrate and monitor machinery to keep readings stable. They communicate constantly and share information to prevent missed details. This gives you multiple expert eyes watching over you. If something odd appears, the technician tells the nurse immediately, and they act together. In training, we practice communication repeatedly. We learn to speak clearly and respectfully to share accurate information. This teamwork makes dialysis care safe, effective, and supportive. This collaboration creates a strong safety net. We are all working together to achieve the best results for you. We're all working together to achieve the best results for you. One of our biggest and most serious jobs in the dialysis clinic is to protect you from infections. Because dialysis involves connecting your bloodstream to a machine, we have to be extra careful. We follow strict rules for infection control and never skip a single step. Germs are tiny and invisible, but can cause big problems if they get into your body. It all starts with one of the simplest but most powerful actions: washing our hands. Hand hygiene is the #1 rule in infection prevention. We do it before we touch you, before we touch your access site, and before we handle any equipment. We practice correct technique: palms, back of hands, between fingers, and under nails. In simulation, we practice this over and over until it becomes automatic. Another important part of our safety uniform is personal protective equipment: gloves, gowns, and masks or face shields. We wear gloves every time we need to touch your vascular access or anything that might contact blood. We change gloves frequently, especially between touching different surfaces or different patients. This prevents germs from hitching a ride from one place to another. We make sure the dialysis station itself, the chair, the machine, the table, is thoroughly cleaned between every single patient. Nothing is left to chance. In training, we learn there are no shortcuts when it comes to safety. Even a small mistake, like forgetting to change gloves or not cleaning a surface properly, could lead to a serious infection. We are meticulous because lives depend on it. Our goal is to make the dialysis clinic one of the safest places you can be, so you can relax and focus on getting the treatment you need. These steps are our promise to protect you. We do this every time, for every patient. Now, let's walk through the hands-on checks we perform in those crucial minutes before your treatment begins. This is where we gather all the important information about how your body is doing today. The very first thing we usually do is take your vital signs. We'll gently wrap a cuff around your arm to check your blood pressure and heart rate. And we check heart rate and oxygenation. We also take your temperature to rule out fever. These numbers tell us a lot. If your blood pressure is very high or very low, we might need to adjust the dialysis plan. We consult and change settings accordingly. Next up is the weigh-in. We step you on a scale before you settle into your chair. The difference between your current weight and your dry weight tells us exactly how much fluid we need to remove. We calculate fluid removal precisely to make your session comfortable. Getting this number right is key to helping you feel your best. After vitals and weight, we inspect your vascular access carefully. We look for redness, swelling, drainage, or tenderness, anything that could signal infection or blockage. For fistulas and grafts, we feel for a thrill and listen for a bruit, signs of good blood flow. Finally, we turn to the dialysis machine. The technician does deep cleaning and safety checks. We double-check the dialysis prescription and confirm machine settings match the plan. We ensure all tubes and connections are secure. This final verification is like a pre-flight checklist. It guarantees a safe and effective start to your session. A careful start makes the whole session smoother. Beyond all the numbers and physical checks, there is something else that is just as important: our conversation with you. Good, clear, and kind communication is at the heart of great patient care. This isn't just about being polite. It's a powerful tool that helps us understand what's really going on with you. We will always start by asking simple, open questions like, how have you been feeling since your last treatment? Is there anything bothering you today? Your answers give us valuable clues we can't get from a machine or a scale. Listening is just as important as talking. If you say you've been feeling more tired than usual, or have a poor appetite, that helps us a lot. It might be related to dialysis or something else. We put the pieces together. We can then adjust your care, or let the doctor know. We practice active listening to understand the feeling behind your words. This helps us respond with empathy and show we truly care. We use simple language and clear explanations so you feel informed and involved. Understanding what is happening reduces worry and empowers you. We welcome your questions and answer them honestly. Open dialogue builds a partnership. If you have questions about diet or medications, ask us. Feeling dizzy or nauseous during treatment? Tell us immediately. We can't fix what we don't know. Your voice is one of the most important safety tools. Good communication empowers you to take an active role. It builds trust between you and your care team. It becomes a supportive, collaborative journey toward better health. Sometimes, the best way to understand why these checks matter is to hear real-life situations. These little stories show how paying attention to small details can make a huge difference. For instance, John came in for his regular treatment. Nurse Sarah noticed the skin over his fistula looked a little pinker than usual. John said it felt fine, so it would have been easy to ignore. But Sarah called the doctor to be safe. It turned out to be the very beginning of an infection. They started antibiotics right away. The infection cleared quickly without serious problems. Another patient, Maria, seemed quieter and anxious one morning.
Is everything all right?
She admitted she had forgotten her blood pressure medicine that morning. With that knowledge, the team slowed fluid removal and monitored blood pressure more frequently. They prevented her from feeling dizzy during treatment. Because she felt safe to share, the team protected her health. A few seconds of careful observation prevented a major crisis for John, all because a nurse trusted her training and paid attention to a tiny detail. A kind question and a moment of patience can build the trust needed for patients to share critical information. This human connection leads to safer care for everyone. It ensures we don't miss the little things that matter to your health. Approach each treatment seeing the assessment as a positive, reassuring start. While your dialysis team has a very important job to do, it's essential to remember that you are the star player on this team. Your active participation can make a world of difference in how you feel and how well the treatment works. Pay attention to your body between sessions. You are the expert on you. More tired than usual? Ankle swollen? Had a fever? Share this with your care team. Keep track and share this information at your next appointment. Protect your vascular access. Keep it clean and dry and avoid tight clothing or jewelry on that arm. Avoid bracelets and tight sleeves. Never let anyone take BP or draw blood from your access arm. Learn to check your own access. Feel the gentle buzzing, the thrill. If the thrill is gone, or you see redness or swelling, call your clinic right away. Be prepared. Follow diet and fluid restrictions. Come on time. Wear comfortable loose clothing. Follow diet restrictions and measured fluid intake recommended by your team. Being prepared helps the whole clinic run smoothly and shows we're working together. Never be afraid to ask questions or speak up if something doesn't feel right. Don't understand your treatment or medications? Ask us to explain again. Feeling dizzy, nauseous, or uncomfortable? Tell us immediately. Your voice is one of the most important safety tools. By being active and communicative, you help us provide the safest, most effective care. Working together ensures every treatment begins on the best note, a safe, effective session that helps you live fully. As we come to the end of our discussion, let's bring everything together. That initial 10-minute patient assessment before every dialysis session is more than a checklist. It is the foundation of a safe, successful, supportive partnership with your care team. By checking your vitals, your weight, and your access site, we gather information to tailor today's treatment. This preparation prevents problems and helps ensure each session is as gentle as possible. This is a blend of science and compassion. Science, accurate measurements and strict safety protocols to prevent infections. These steps are non-negotiable. They create a shield of safety around you. They reflect our professionalism and commitment. Compassion, friendly questions, careful listening, and clear explanations. Remember John and Maria. Small actions, kind questions, and attention to detail made a huge difference. Noticing subtle changes and asking a kind question can prevent major problems. Every step in the assessment has a purpose. Be prepared, come on time, and speak up if something doesn't feel right. Working together ensures every treatment begins on the best note. A safe session and an effective session that helps you live fully. This careful start isn't just good practice, it's our promise, delivered with professionalism and a warm, supportive smile. We are here to keep you safe and cared for. Thank you for being an active partner. Together, we start every treatment the right way, with you at the center. If you enjoy this video, please take a second to like and subscribe. Also, check the description below for links to additional useful resources.